The next bill is by Senator Urso, Board of Medical Licensure and Discipline. Would you like to introduce your bill, Senator?
Yes, I would, Madam Chair. Thank you very much for the opportunity. I'm introducing this afternoon Senate Bill 347, which would amend Title V, Chapter 37 of the General Laws to allow a pathway for internationally trained doctors to practice medicine in designated healthcare facilities in underserved and rural areas where the need is great, and also to facilitate licensure of those doctors after a period of mentorship of at least 3 years. Now we're hearing every day about the primary care crisis, and it's growing worse. And our citizens, our constituents are looking to us to come up with solutions for this problem. This bill, or this has been enacted, similar bills have been enacted now in 9 states and under consideration in 17 states, including ours. This bill defines an internationally trained physician as someone who has been awarded the degree of Doctor of Medicine from an international program that has been recognized by the World Health Organization and who has been licensed to practice for at least 1 year. Now, in a state as diverse as ours, it is not uncommon for our residents to return to their countries of origin to seek medical and dental care for either cost reasons or availability reasons. There is a level of comfort with our citizens with international care, so there should be no reason that same comfort wouldn't be felt here through that same care on American soil. This bill was heard in the House last month, and a lot of the testimony centered around the licensure as opposed to the practice. But it's the practice that gets at the heart of this bill, because it's through that observational practice that international physicians can make a beneficial and necessary contribution now to this crisis to alleviate some of the situation we're dealing with while they are working toward licensure, which could be a period of 3 to 5 years. Now, I can see Neil from the Department of the Health, Neil Heitinen is here, and Dr. Stacy Fisher. They both testified in the House, and I have great respect for the work they do. Dr. Fisher talked about how the Department of Health is looking into expanding the regulations to allow us to bring doctors here to practice. It's not necessarily that we have to try to bring doctors during an immigration crisis. We have skilled doctors here in this country now who are underemployed and who could be putting their skills to good use if we could create this pathway. They also talked about an implementation concern that had to do with the Board of Medical Licensure having to take the responsibility of verifying the suitability of residency and training programs from overseas programs, and that the Board of Medical Licensure is not able to do that. And I'd like to hear from Dr. Fisher as to why they are not able to do that. Is it a time and staff issue? Is it a legal consideration? Is it a financial consideration? Do we have to finance these reviews? If other states have these programs and they're looking into the same suitability, is there a possibility for information sharing? I think we need to meet this moment with what we can do and how we can get to that end. And lastly, I wouldn't be deterred by the suggestion that because other states with these laws haven't been able to license doctors, that this isn't a valid program. And I noticed in their letter that they referenced Tennessee as having passed in 2019. In fact, Tennessee enacted their law in April 2023, and they've only just put their application portal online in March of 2025. These are new programs, they're laws that have passed in the last year and a half, and it takes time to launch a program. And also, some of the states are saying the holdup has to do with the Board of Medical Licensures not getting the regulations in place. So I think that, as part of a comprehensive solution to the primary care shortage, we have to look at all of the options. I feel that this is a viable option, and I would respectfully ask you to give this bill your consideration, and I'm looking forward to the testimony. Thank you.